Hello, my name's Gabrielle Vieira, and I'm a graduate student here at Merrimack College, soon to be graduating with my master's degree of athletic training. Today, I will be presenting a case study on post-op stressors on student athletes. I would like to firstly go over my patient's information. This case is about an African American female basketball player. She's a junior in high school right now and comes from a middle-class family. Her personality is very outgoing and positive. She's the type of person that will say hello to everyone no matter what. You can find her playing basketball all year round for the school and for club teams. She had a previous surgery done in July of 2019. This was an ACL reconstruction surgery with a patella graft. After this surgery, she was able to jump right into rehab at a PT clinic. And in this upcoming winter season, she was able to compete for the high school team. During this winter season, she was experiencing pain and swelling at her knee. We were able to do some flushing massage to get any fluid away from the joint and provide her with a compression sleeve to help with swelling. This treatment was done a couple times a week for about 3 weeks, and there seemed to be no improvement. So we were able to refer her out to get some imaging done. This imaging concluded that she was suffering from a bone bruise of the tibia along with inflammation of her meniscus. Once this information was sent to us, her parents also reached out, communicating their concerns of their daughter's attitude. There was a shift in her positive attitude, and it seemed as though she was isolating herself more. The patient and family both agreed that seeing a sports psychologist may be helpful. Next, I'll talk about the structures involved in this case a little bit. The ACL itself helps resist anterior tibial translation and internal rotation of the tibia. The meniscus provides a cushion to the tibia from the femur. The bone bruise was experienced by the patient from the femur rubbing against the tibia due to the meniscus being worn down. The ACL was then reconstructed with the patella graft, and then as pictured above, the middle portion of the patella tendon was taken, then placed in the posterior aspect of the femur, and it was fed through to the anterior aspect of the tibia. This patient was feeling both competitive stressors and personal stressors. Competitive stressors are stressors that relate directly to a sporting situation. She felt as though she had pressure on her to perform well and also be ready to play quickly. She had just got recruited from a D1 college to play basketball, so she felt as though all eyes were on her and that she had to be the best, or that school would not want her anymore. A personal stressor are those personal demands the athlete places on themselves. She experienced having the struggle to find a balance with sport and school, and she wants to be able to handle her stress better. Moving on to mental health. Mental health is very important, and I think it's very important that healthcare providers are able to identify when their patient is struggling with some mental health problems that may be stemming from an injury. In this case, this patient dealt with a long recovery process to be able to play again, and then she stumbled upon another injury when she just had started to play again. Some emotional responses seen from injury are sadness, isolation, lack of motivation, anger, changes in sleep, and many more. Patients may also become depressed from not being able to do the thing they love or have anxiety that this injury may keep them from being as good as they were before injury had happened. It is known that the final goal of rehab for a patient is to get them to return to play. Research has also found that post-op outcomes for an ACL reconstruction focuses on knee stability and muscle strength, but there's more than just getting the athlete back to play physically. It takes both the physical and psychological readiness. Athletes can be physically ready to play, but if their mind is not in the same place, then they are not fully ready. Research indicates that you should have a team of healthcare providers, such as a doctor, a nutritionist, athletic trainer, PT, and most importantly, the patient. Having this team helps you provide the best care for those patients that may be suffering from other conditions other than physical injury itself. One article done by the NCAA indicated that when the athletic trainer showed compassion to any of the psychological needs, there was a spike in motivation from the patient to keep up with rehab and open up about how they feel. One tool that can be used is this ACL Return to Sport Index. The screening tool is used to identify how confident the patient is or isn't confident about returning to play. This can be used before a season as part of the pre-participation exam and also during any rehab sessions to make sure your patient is mentally ready along with being physically ready to compete. I hope you all were able to take home some information about this case, realizing that the whole patient needs to be treated, not only their physical injury, but their mental health as well. And also knowing that all people are different and have their own stressors that may impact their return to play.